Hi everybody, this is Dr. Connie. So today I want to talk to you about labs. So typically when a physician checks your blood chemistry, they're looking for abnormal labs or disease. Then they take action if the results are abnormal. Let's talk about the problem with the conventional labs. Many won't show positive markers until the disease is progressed enough to show up on the labs. You may have significant symptoms that are causing suffering in your life. So you're prescribed meds to keep symptoms at bay and wait until the disease progresses to a point where the doctors can do something about it. That happened to me. That something is typically prescribing the right medication for your disease. Reference ranges are another issue. Typically, those reference ranges are too wide. For example, TSH is considered normal between 0.2 to 4.5. However, there are many studies that indicate that the body does not function properly when TSH rises above 2.5. A study published in the Journal of Endocrinology and Metabolism in 2010 showed that the rate of miscarriage in first trimester pregnancy was almost double when TSH was over 2.5. I don't know about you, but the conventional lab process seems very reactive and irresponsible sometimes. Why wait until you have the disease to treat it when you can check various health markers which will help to prevent disease and keep you from taking meds and also going in and out of the hospital like I did? This has been my soapbox for a very long time. Why? Because many of you know I was that subject to the system. The system waited until I was diseased to be able to treat it. It's a sick system. Since becoming certified in functional medicine, though, I've been reflecting on a better way to provide preventative care for our patients. Responsibility is great, and it's very important that we don't make unnecessary strides in the practice of functional medicine. But I do believe certain laboratory testing is necessary to track our health, mostly to stay one step ahead of the game. I recently received a bill from the insurance for my labs, and it was over $2,300. Of course, much of it fell on my deductible, so I had to pay a couple of $100s. But my point is that those labs that are standard in the medical industry are inflated to the point of bankrupting those who have no insurance, and this happens a lot. But if we do have insurance, then it provides a significant cost savings up to 80%. And as a functional medicine practitioner, many specialty labs are knocking at our door on a daily basis with new labs and for new business. We've held out on performing testing until now because we wanted to make sure that if we do the testing, that knowledge is valuable in our patient's treatment. We also wanted to make sure that the cost made sense for our patients because they can be very expensive. While we extend our actual cost to the patient, some labs just are plain expensive. So some essential specialty labs though, but this depends also on your symptoms and risks. Number one is AVISE testing. If we suspect autoimmune conditions, this will provide us with a detailed information on the prognoses to differentiate autoimmune conditions such as lupus, RA, rheumatoid arthritis, Hashimoto's, celiac, etc. Number two is food reactivity screening. After the course of our signature alkaline detox protocol, if the patient continues with symptoms, we'd like to go deeper. Number three is irritable bowel SIBO screen. This is a simple test that can be usually very beneficial to our patients. Number four is comprehensive stool analysis. Assessing our gut function is the most important pillar at Alkaline Wellness. This test looks for markers of inflammation and malabsorption, which is essential for those with irritable bowel syndrome, inflammatory bowel disease, diabetes, autoimmune conditions, weight loss or weight gain, and cardiovascular disease. Number five is adrenal stress profile, which allows us to measure adrenal imbalance, which is especially important because of its impact on thyroid, autoimmune, fatigue, and much of mood disorders as well. Number six is organic acid testing. which allows us to assess metabolic function, as organic acids are essential for proper detoxification pathways. Number 7 is comprehensive hormone testing. For both men and women, this test allows us to assess hormonal balance to determine if lifestyle changes, supplements, or hormone replacements are necessary to have quality of life. Number 8 is advanced cardiometabolic testing. So traditional testing is simply not adequate to understand the overall risk. This comprehensive testing reveals the true risks in order to make necessary changes in lifestyle, as well as necessary supplementation to optimize your health. Number 9 is heavy metal essential element testing. We do live in a toxic world. Such toxic elements can lead to autoimmune, gut dysfunctions, and various disease processes. If certain levels are out of normal ranges, then we can begin to chelate or chelation therapy to get rid of such toxins. So essential conventional labs, you can usually get these tested by your primary doctor and paid under your insurance. I'm all about that. Number 1 is essential nutrients: iron levels, ferritin, vitamin D, B12, magnesium. These nutritional levels are not typically checked in a routine primary care visit. Our bodies depend so much on the balance of various nutrients, including iron, vitamin D, vitamin B12, and magnesium, especially because so many people are deficient in them. So supplementation, if you're deficient, can be life-changing. And it's magical what can happen when you provide your body with the necessary nutrients it needs to function at its best. So I'd highly recommend asking your doctor to check those. Number 2 is complete metabolic panel and complete blood count. Number 3, there are 2 panels of labs that are always ordered at an annual physical. They measure a person's electrolyte and hydration status, kidney, liver function, and blood cell values to assess for infection and anemia, clotting, etc. Metabolic markers like HbA1c, fasting glucose, insulin, and lipid panel. Metabolic markers help to assess how you're metabolizing the foods that you consume. And a basic comprehensive metabolic panel, as I mentioned, to be tested, will be covered at your yearly physical. So get your physicals on a regular basis. However, if your values are in higher limits of normal or high, then we prefer to assess the advanced lipid panel that I mentioned to further understand in detail of your actual risk for disease. Many times, a patient may have high cholesterol, but upon closer examination with the testing that I mentioned, depending on your particle size of LDL, for example, you may not be at risk. Number 5 is hs-CRP, homocysteine, which are inflammatory markers that almost are never checked at a routine primary care visit. hs-CRP is an inflammatory marker which can tell us the general inflammatory status of the individual. Slight increases in SCRP or hs-CRP are associated with increased risk of physiological dysfunction that can manifest as cardiac events or even depression. Homocysteine is an amino acid that requires methylated vitamin B12 and folate to be cleared. Elevations in these levels are indicative of increased risk for stroke, heart disease, B vitamin status, and the ability to methylate, detox, and convert to neurotransmitters that we need, as well as trigger our cancer genes. To emphasize the importance of ranges, there's a difference between optimal range and normal range. For example, for vitamin D, the normal range is from 20 to 100 nanomoles per liter, but we consider optimal ranges to be about 50 to 80. But normally, if it's at about 35, which is suboptimal in my book, your doctor won't prescribe any vitamin D. Such testing, as I previously mentioned, are considered the most important. Based on your symptoms and goals, there are others that we can check. However, certain testing are covered by your insurance through your primary physician, so we'd like to take that up. Our goal is to maximize savings and minimize unnecessary spending for our patients to help them regain their health and life. Many patients are left confused and suffering because labs, tests, and scans are normal, but they struggle every day with physical, mental, or emotional symptoms that are keeping them from living their lives. They have severe digestive issues, fatigue, pain, and brain fog that make it hard for them to stay productive in their lives. They've gone to just about every specialist, some even to the Mayo Clinic, only to leave puzzled with a growing list of medications to simply try. Unfortunately, our current medical system is structured to treat sick care. And the truth is, sick care makes much more business sense for the healthcare practitioners than getting their patients healthy. If we have healthy, thriving individuals, hospitals, physicians, pharmaceutical companies, and insurance companies would be in a financial crisis. At Alkaline Health, we believe in prevention and actively empowering you to create health. We understand our patients and their fundamental needs. And at the core, our patients just want to be the best versions of themselves as mothers, fathers, men, women, student, professional, and want to look and feel good every day. And because prevention is not lucrative, insurances don't cover the level of services that we offer. What we do recommend is we believe you should get an annual physical that's paid by your insurance. We then use those biomarkers to assess your health status. We dive deeper to understand everything from your health struggles to your health goals, and we order further specialty testing only if necessary to ensure we understand your health baseline. Then we get down to the nitty-gritty of creating a lifestyle program addressing the common struggles you have on a day-to-day basis, such as making choices on foods to eat, whether to exercise or not, if so, which exercise, and the practice of presence and mindfulness, etc. Many conventional physicians are not trained to check those specialty labs. At Alkaline Health, we're trained in advanced lab assessment to use as a preventative tool to ensure optimal health for our patients. I hope this is helpful to you. Wherever you are, you can likely request such testing and get educated so that you can keep your health under your control. Remember, an ounce of prevention every day is key in staying as healthy as possible. Thank you so much for listening, and as always, please subscribe to our YouTube channel and our podcast, and follow and like us on our social media channels, Lupus Rebel and Alkaline Wellness. And have a great weekend. See you next week.